Today, not once, I will remind you in no case not to perform massage on carotid arteries. Here is located, you see this lateral anterior, this map shows a little bit approximately 45-degree turn the head to the left side, and this is this artery, pretty large artery. When you place your fingers, you feel, you cannot miss. And you see a little bit here, it's already not an artery, and here, and of course when we're massaging this part, is free of all these big large arteries, include carotid heart. How to avoid? The plus minus location is lateral anterior, but at best you place two fingers. Oh, this is very large artery, you cannot miss. If this palpate here, you're not massaging, but a bit lateral line. You see, here is the carotid and here is the lateral line. You can and should to perform. And here is, for example, you see, I put my both hands on lateral line, but I right now will palpate. Where is the artery? Oh, artery here. You see the distance, where is my tip of the fingers and where is the artery? You just double check, and plus minus, you'll know forever where not to massage, and that's all. We don't have to afraid too much not to massage. In the same time, we have to be aware that we cannot massage carotid artery, otherwise rates of heart could be dropped significant, and significant complication in cardio work could be. And this is, in no case, it's absolutely prohibited to massage carotid arteries. Now, we're turning our head approximately 50 degrees to the right. And of course, you see exposed area for stimulation is the left side. And my right hand I will place lateral posterior. Now, all mobilization what I will do, excluding carotid artery, will be performed a little bit under angle, like this. You see, with one finger I will show you, will see direction. This is the direction we will divide. In my case, my neck pretty short, will be 3-4 strips. Somebody with longer neck, probably 5 or 6 even strips. But with finger I just show you direction, yeah? And right now, all my 4 fingers of right hand I will place posterior, yeah? And little by little, at the time when I will stretch to the direction under angle until I move few degrees of my neck. Now you see it is pretty significant stretch. Actually, superficial muscles that we stimulate already in fascia, superficial fascia was stimulated to muscles relaxation and tension in fascia release. And right now what I do with this movement, I'm shifting and I exposing to stimulation much deeper layers of muscles. And look, again, it's hold here, I start shifting, and at this time I turn my head. Oh, you can see how deep I went with my fingers, and right now I will do 1, 2, 3, 4. Now I don't remove this stretching, and again, and 1, 2, 3, 4, and again, 1, 2, 3, 4, stretch, 2, 3, 4, and stretch, 2, 3, 4, and stretch. Now, the alternative, some will find difficulties on fingers. The alternative, please try. If this will be difficult for you with fingers, you can do this with this, like I showed in upper trapezius. I already showed you how to do this. With this bulge, by flexing thumb, this phalanx, you see bulging, you exactly like this, you can put and 1, 2, 3, 4, 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 and 1. And remember, carotid artery is here. Yeah. Yep. Yeah, you saw I finish, kind of will cover this white one strip, and I will go to the other and lower, about under angle. 1, 2, 3, 4, 1, 2, 3, 4. And now when you did always fingers stimulation, always thumb, like 10 strips, it is time. You can with knuckle, you can with fingers, like initial and one movement strip, one. It is very massive already. All muscles in a kind of resting tonus, plus minus normal, that you with this movement you can effectively and equal to mobilize all posterior, anterior and lateral muscles of neck that responsible for all this movement, and due to traumas usually all of them affected negative, all of them kind of inflamed and suffering from higher resting tone, and as a result decrease of blood supply and etc. We're doing all these muscles, we're mobilizing all these muscles, and of course excluding carotid artery. And on the right side I will demonstrate with minimal commentary. I hope and believe that I explained enough, and I demonstrate on the left side. And on the right side you turn your head to the left approximately 50 degrees. You place like this, stretch, stimulation, stretch, stimulation, stretch, stimulation. And kind of right now, finally you're mobilizing all these muscles in one movement. You're not stopping to stimulate local like this. All this stimulation, what I demonstrate for you, all these 4 steps probably will take all together 5-6 minutes altogether. I mean 5-6 minutes, 7 minutes in a frame